Unfortunately, permanent teeth do get knocked out all the time. So this is not a scenario where we have to imagine this. We see this all the time as pediatric dentists, sadly. Luckily, where I was trained in a level 1 trauma center in the Bronx. So we had a lot more injuries than just a tooth being fractured or knocked out. I have had to deal with mandible fractures, facial fractures, lacerations, and the tooth getting knocked out is kind of just the tip of the iceberg compared to what we are used to seeing and what we're trained to see. But for any child or parent going through this scenario, this is obviously extremely stressful. My best advice for you is if you're right there when the tooth gets knocked out and it happens, hold the edge of the tooth by the enamel crown. And if it's clean, you can put it right back in. And if you don't have the guts to do that, which most people don't, you want to have us on your speed dial and get over to us as soon as possible. If you have the tooth, you want to make sure the tooth does not get dried out. So the easiest thing to do is have a cup or some kind of plastic bag and have the child's saliva in the bag with the tooth that's knocked out within it. So that way the tooth doesn't dry out. If you don't have saliva and you have milk, that's fine too. But the goal is to get to your pediatric dentist as soon as possible, ideally within 60 minutes. So, that's the best advice that we can give you. And afterwards, we'll take it from there. Some of the most common dental injuries we see in the Sorrento Valley area are kids that have their teeth either pushed out or pushed back from karate, jujitsu, or any of those school sports. If you have anything like that happens, obviously we're here for you. You can contact us at any time. At Sorrento Valley Pediatric Dentistry, we do prioritize same-day appointments for children who have true emergencies or are in pain, so we can make sure that they're not left waiting and help you out as best as we can. You can call us, email us anytime, whether you're a new patient or an existing patient, and we'll try to get you and your child managed as soon as possible. So if your child had a scary dental injury and they do need to see us, one thing that I could say as a dentist, seeing, many of these scenarios, is it's really important for a child to be in a familiar place. As soon as the child walks into the dentist, that and they know they're going to be taken care of, and you're with specialists that are going to explain things step by step by step to your child, and take the time with your child, you'll see that they're going to become a lot more comfortable and be able to be treated as best as possible. So as pediatric dentists, this is what we do. This is what we're about. My best dental emergency kit advice for any parent is to have your point of contacts on speed dial or easily accessible on your phone. So you should know where your closest emergency room is, what's their address, what's their phone number. You should have a dental home, which is an established pediatric dental office that you know and trust, where you can, directly get in those kind of, instances of emergency. You don't want to be left scrambling, not knowing what to do, and getting suboptimal care. So as a parent, it's good to have a plan of action in case of these kind of scenarios, so you know exactly what to do when those kind of situations arise. Toothaches do happen at the worst possible time. So don't worry, we are experts in these kinds of scenarios. The best thing I can say to parents is don't wait till your child is in extreme pain to come in when you have a problem. We know that dentists can be intimidating and scary for adults, but for children, we can really help prevent these kinds of scenarios. When you have severe pain in a child, it usually means that the infection is going full blast, and we can really prevent hospitalizations and those kind of severe infections with early detection and early dental care. This is why we actually have our first dental appointment as soon as the first tooth comes out or before age 1. We try to, mitigate problems and prevent issues before they start. And when your child does have a problem that's, unexpected or out of the ordinary, then you're in a dental home and your child is comfortable knowing the people, the surroundings, and the person that's going to be treating them. So That would be my best advice, for a patient that's, been seeing the dentist. And if we haven't met you yet, don't worry, come in. We'll get you accommodated to our office. We'll show you around and we'll make sure your kid is taken care of and comfortable, and walk them through what needs to be done and how we do it. After your child has had some type of emergency dental care, your appointment doesn't just end and your care doesn't just end as soon as you walk out the door. We usually will follow up with you by a phone call on the same day as your appointment. And if needed, we usually will advise some type of follow-up care so we can evaluate how your child is doing in person. We're here for you, from the beginning to the end of your child's healing. And we want to make sure that you, as a parent, have full understanding of any postoperative instructions that we have, and that we're also here for you to answer any questions that might come up once you're home and outside of the office. So, we're here for your child from the moment you contact us till the very end until everything is 100% healed and, we ourselves are satisfied.